How mesenchymal stem cells regenerate tissue and stop pain. We harvest mesenchymal stem cells from the patient's adipose tissue, either from the anterior abdominal wall, or if the patient has very low fat percentage, we can harvest from the buttocks. The aspirated tissue is placed in a centrifuge where it's spun at low speed to separate out the fatty tissue from any free lipids, and from the tumescent fluid injected at the beginning of the procedure. The resulting fatty tissue is then mechanically stimulated in order to free the stem cells from the extracellular matrix and to destroy the unnecessary adipocytes, fat cells, as they are of no help to the regenerative process as living cells, but when damaged or destroyed, become a rich resource from which the stem cells can harvest many necessary materials to repair the injured tissues and to build new tissues in an arthritic joint. Mesenchymal stem cells respond to inflammation, cell damage and death, cell malnutrition and infection with various factor secretions and exosomes. In particular, mesenchymal stem cells release paracrine factors which fall into three main categories. 1. Immunomodulatory effects – temper the immune system. 2. Recruitment of endogenous stem cells, local to the area. 3. Angiogenesis – the growth of new blood vessels. The stem cells then release paracrine factors. These are signaling chemicals which affect only nearby cells, rather than traveling in the blood or other fluid to a distant target. Their purpose is to stimulate the local cells and tissues to respond appropriately. Many of the same chemicals are released. These chemicals are responsible for the proliferation and differentiation of stem cells. Proliferation describes the process whereby stem cells multiply, and differentiation is the process where stem cells evolve into a different type of cell, depending on what is needed. Mesenchymal stem cells can, through the processes outlined above, cause their surrounding tissues to remodel, which means that the fundamental structure of the tissue can be improved. They can also cause contraction or tightening of the tissue, help stop bleeding, encourage new blood vessel formation, and therefore more nutrient and oxygen for the tissues. During the months and years after a stem cell transplantation, the tissues will have the ongoing potential for further growth and repair.